Doctors, in this video, we're going to take a look at another tool for your toolbox. And I mentioned earlier that it's really advantageous to have many ways that we can affect articulations. We have those patients that love their adjustments. We have those patients that have never been to a chiropractor and they're mortally afraid of a cervical manipulation. And in our practice, I didn't try to dissuade the patient. I knew I had other tools. And in these last two videos, we're going to take a look at some ways that we can affect these patients and still consider their needs and wishes. In this case, we're going to be looking at mobilization. We're going to look at primarily cardinal ranges of motion, and then we're going to finish up with one of my favorite, which I call the figure eight. Very simply, patient is supine. My favorite way to mobilize a joint. The contact point is the first MP, and different hand stabilizes the head. And certainly we can start off with lateral flexion, just medial lateral, and when you take it out to the end, just some nice oscillations at the end point. Try to put a little bit of inferior to superior direction into your mobilization. Certainly rotation, very similar. You can also do long axis extension. In this case, I'm making a contact point on the articular pillars with my index. Relax. And just as a bonus, the occipital lift is not much different than that. Just take a contact across the bottom of the occiput, a little impulse. Get sometimes a nice little release. Posterior anterior, again, you take a contact on the posterior articular pillar with the first MP joint. Take the patient into extension. And some nice little thrusts right at the end. I mentioned earlier about the figure eight maneuver, which is one of my favorites. So quick and dirty, pretty much affects everything in the cervical spine at one time. If you look at the patient's chin, we're going to draw a figure eight in space with their chin. And then reverse the direction. Pretty much by the time you're done with this, that neck is pretty loose and ready for adjustments. Mobilization is not only a tool that we can use for patients who can't tolerate frank manipulation, but it's also a nice tool to use as a pre-manipulative procedure to get the neck loosened up and ready for the adjustment.